You're listening to Nutrition Matters podcast with Paige Smathers, registered dietitian nutritionist. Nutrition Matters podcast explores how to approach food and your body in a whole new way. I interview people who share stories and expertise in rejecting diet culture, making peace with food, and discovering a more positive, realistic, and sustainable approach to health and well-being. I'm Paige Smathers, registered dietitian nutritionist, and owner of Positive Nutrition, an in-person nutrition therapy practice in Salt Lake City, Utah. I offer free resources, including this podcast, a blog, and posts on social media. If you're local to Salt Lake City, check out our services and availability for appointments, and keep your eyes out for in-person groups on mindfulness, intuitive eating, body image resilience, and more. Go to positive-nutrition.com and hit subscribe if you'd like to keep in touch. I also offer online courses covering topics like the science of nutrition, mindfulness, and healing your relationship with food. Check those out at positive-nutrition.com/academy. If you like what you hear on the podcast, you can make a difference by leaving a review, sharing with friends and family, or making a donation. Thank you so much for your support. You can also find me on Instagram or Facebook if you'd like to have a little more food for thought at Paige Smathers RD. Thank you so much for listening. Hello, everyone, and welcome back to another episode of Nutrition Matters podcast. My name is Paige, and I'm your host, and I'm thinking of you. I hope that all of you are doing okay. This is quite the, I don't even know what to call it, quite the intense time we're in right now. I hope that it doesn't feel insensitive to be posting podcasts that aren't related to coronavirus, but I hope that you understand that kind of where I'm coming from is I want to continue to put stuff out there. I know for some people you might not have the bandwidth to really think about anything else other than just day-to-day getting by, but I know many of you maybe are looking for just something else to occupy your time and your mind, and so wherever you are with how you're dealing with this or how you're thinking about it, just know you have my support, and I want you to take care of yourself. If it feels good to kind of explore some topics in the realm of eating disorders, nutrition, recovery, then feel free to continue to tune in. I am planning on continuing to post my planned episodes every other week, and I will check in these intros and just let you know I'm here for you, and I'm supporting you, and I'm thinking of you. And yeah, so that's the plan from here on out. I'll continue to post these episodes. And I also just want you to know I'm thinking of you lots, and I hope that you're doing great. Today's podcast is with Shira Rose, who is a licensed clinical social worker, an eating disorder therapist, also someone who is very open and upfront about her own struggle with an eating disorder. She's making real waves in the eating disorder treatment space. I appreciate her voice so much, and she's doing such important work to shed light on the problem of Fat-Phobia in eating disorder treatment. So that's our topic for the day. We're talking about her own experiences and kind of what she wished would change in the eating disorder treatment field. And this is a really important conversation. I was so grateful that she took the time to talk with me about this, and I really hope that you enjoy this conversation. Please just know that both of us are pro-treatment. We are not at all trying to say that you should not go to a treatment center, and we make that clear in the episode as well, but I just want to kind of say that up front. And we are also coming from a place of deep care and concern for eating disorder patients, and we hope that we can provide some solutions through opening up dialogues about where we might be able to improve. All right, so with that, let's get into this conversation with Shira, and I hope you enjoy. Hi, Shira. Thank you for joining me, and welcome to Nutrition Matters podcast.
Thank you, Paige. So excited to be here.
So excited to finally have you on. This has been a long time coming.
I know. I feel like we talked about it a year ago or something.
Yeah, and lots has happened since then, which is exactly what we'll be talking about today. So,
yeah.
So Shira, will you take a minute and just kind of introduce yourself to any listeners who might not already know you or be familiar with your work?
Sure. So I'm a therapist and I practice in Chelsea, Manhattan. And I work with eating disorders, disordered eating, body image, and all from a very passionate health at every size framework. And I started off as a fashion blogger where I really just basically exclusively only did fashion and then transitioned into being very vocal about health at every size and inclusive fashion. And then I started talking about my own eating disorder recovery. And so it's kind of a whole bunch of stuff on my blog as well.
When did you start your blog?
I started my blog right when I graduated social work school. So I guess at this point it's been like 7 years. So it's been quite a while.
And talk about
Yeah.
what you do there and kind of what the mission has been.
Yeah. So I'm very passionate about making sure that the fashion that I share is as inclusive as possible. I wish I could make sure there was options, up to size 40 and 50 and beyond. But unfortunately, our plus size fashion is still so problematic. So I do my best to at least include up to size 26, 28, and as much as I can. And that's the minimum that I'll make sure that we have listed. But yeah, so basically, it's just important to me that this is not another place where somebody feels bad about themselves or not included, because that is, I feel like, happens so much everywhere else. And I don't want it to be where they get it from me as well.
Yeah. And you're also really passionate about rainbows and sequins and unicorns. I feel like we have to
Yes,
mention
all the
that.
colorful thing. Oh my gosh, yes. You're not going to see anything remotely minimalistic on my blog.
Right.
Never.
So if that's what you're looking for, go somewhere else.
Right. No, no, no. It's too sad for me. That just makes me sad. No, I
Yeah.
need all the color.
Full color. I love it.
Hmm.
I'm wearing a tie-dye sweatshirt that you were excited about today. So
I'm probably gonna steal it from you, like
okay,
somehow
I'm gonna
across
tell
the country,
you.
but it's fine.
Okay, and maybe we can find it. I'll find where my sister bought it and send it your way. It's very comfy.
On a mission.
Okay, so Shira, you have been a therapist, you said, for 7 years?
Yeah, I graduated school when I was 24, and then I started practicing 24, 25, and I'm 31 now. So,
Okay, yeah.
yep.
So, and you've always been in the eating disorder field in your entire career, is that right?
Yeah, I mean, when I first started, it kind of happened accidentally. I had my own eating disorder past, and so I thought, I kind of thought what we learn is you don't go into eating disorders if you have an eating disorder. So I kind of just stayed away. But I was working in a general clinic, so I saw everything and everyone. And then I saw a client who had an eating disorder, and I was like, oh, this is what I want to do. This is what I meant to do. And so my supervisor kind of agreed with that as well. She didn't know my history, but she felt like I did good work. So she kept giving me more eating disorder clients. And then that's kind of when I realized that that's what I really want to be doing. And so then that's when I actively pursued it.
So tell me, like, what clicked with that first client? Like, what did you feel? What did you love about it?
I just felt like I love kids, and that's what I was seeing a lot of, and that was fine, but I was getting bored. And then I saw this client and I wasn't bored, and I was excited and I was passionate, and I felt like I just I got it. And I want to be careful to say that just because I have my own eating disorder, it doesn't mean that I think I know what everyone else's experiences are like. Everyone has such unique stories, and that's really important to note. But I just was able to get this and the struggle on a level maybe that other people might not. And so I just felt important, and it just felt like something, I don't know, like I was meant to do this.
Yeah, kind of just like that unexplainable, like this is what you're called to do. This is what you want to do.
Yeah. And I think also because I had a few clients who were never felt safe in their bodies, and I was able to be a therapist that, again, like worked from a health at every size framework, even instinctively before I even had the words for it when I first started. I think that was important for me, knowing how I grew up and how unsafe I was in my larger body. I never ever wanted anyone to experience that, and so it felt pretty good to be able to provide that for other people.
Yeah. Yeah, kind of giving people what you didn't have is sometimes like gives a lot of meaning or purpose to your suffering, right?
Yeah, I really think so.
Yeah, I agree. So what are your thoughts these days about that common thing people say in the eating disorder world, like you can't go into this field if you have an eating disorder history. Talk about kind of how you've thought about that, how that's evolved for
Hmm.
you through the years.
I have so many feelings about it. I don't even know where to start. I think first thing to think about is, I mean, we don't say the same thing. If somebody were to be a therapist and have anxiety or depression, I don't think any of us would ever be like, oh, they shouldn't practice. But somehow with eating disorders, it's so different. I think the problem is there was a big people in the field, and they said, a few decades ago, they made this rule that if you have an eating disorder, you shouldn't be treating people with eating disorders. But like, it's 2020, like, can we grow with the times? Things are changing, and not everything is so black and white. Just because it doesn't work for some people, and it really doesn't. Like, for some people, there's a lot of comparison, and for some
Sure.
people, there's a lot of things that make it too triggering for them. But that's why, I mean, life is not black and white. It's so individualized. Like, if you did this by yourself with, on your own, like, I have like an entire team of people. I've had my own therapist supporting this from day one. I wouldn't have just done this on my own. There was so much conversation and exploration, and with my team, with my supervisors, like, along the way, it was never just me making this decision. But I just also think it's so ableist to say, I don't know, somebody with a mental illness isn't like automatically makes them less qualified or incapable of seeing patients. There's so many assumptions there that I find so problematic. That's just, and also, what about people that um, recovered and then they relapsed? They should quit their job. I mean, I don't know. I feel like there's just so much in there. And then the other piece that really frustrates me is that nobody's questioning the therapists who are dieting and the therapists who are actively harming their clients every single day right now. Like, if we're going to say that no therapist with an eating disorder should treat patients, then I want to know that no therapists who diet see patients. Like, I want to see that happen too.
Boom. I mean,
So,
really, yeah, like mic drop on that. Like I've had experiences as a clinician getting referrals or having a client come my way who's also seeing a therapist who has really harmed them with dieting advice and rhetoric. So I'm with you.
yeah, and it's starting to make me really angry. I think because, I mean, I can tell you, I wish I didn't tell you, and I wish I didn't have these stories, but I have stories and stories from the time I was 12 seeing my first therapist, and the like awful things they told me from day one, and nobody questioned their abilities or their skills as a therapist at all. And they said the most awful things that no one should ever tell a client with an eating disorder. And so it makes me really pretty, like, overwhelmingly upset to think about the fact that none of that comes into play when we think about these things.
Yeah, and it sounds like your overall point is this isn't a black and white issue. It's not like every person who has an eating disorder history who also is a therapist is automatically, well qualified and fine to treat clients with eating disorders, but it's also the flip side is also not true. And it's somewhere it's each individual's decision in addition to their supervision and their own therapist and kind of their own just
Yeah,
situation pl- like
one
playing
million
into that
percent.
decision.
Yeah,
Yeah.
100. Like, that's exactly what it is. Like, it's so individual and depends on the person and their circumstances. And just shouldn't be a blanket rule like anything else in this world. So,
Yeah.
yeah.
Well, and I mean, I'm a huge fan of that idea, that
Mhm.
concept of let's
Nuance.
yeah, of nuance and like let's look at this a little bit deeper and
Hmm.
let's talk about like beyond the surface and just our just knee-jerk reaction, like what else is also there. And I think that's a really good example, at least in our field, of where we might have these kind of assumptions that we really should start questioning and really, looking at more nuance there is really important. So I'm glad you spoke to that.
Yeah.
Okay, so let's talk about the big thing here, which is recently, I don't even know how many months ago, you decided very bravely to share your story. Do you want to just kind of set the stage and talk about what went into opening up and being as vulnerable as you've been? And then maybe I'll just ask some questions along the way.
Yeah, of course. So I had my blog for at least, yeah, 6 years before I decided to share my story. And so I was talking, about inclusive fashion and about health at every size and even eating disorders, but from a therapist's point of view and from just, that kind of thing. And I know I also was struggling with my eating disorder all this time, but nobody knew. And it was very, very lonely. My therapist at one point called it Avatar Shira. My blog was just like another place where I kept kind of walls up and I kept my me at a distance from everyone, and just only showed this like perfect, happy, colorful version of me, which I can't, none of that was a lie, but it just, there was so much more going on underneath that I didn't share. Um, and I also, there were so many things I wanted to talk about in terms of problems in the field and what it's really like to struggle with an eating disorder and what eating disorders look like. And so many things I wanted to share, and I felt like it'd be more powerful if I talked about it from my perspective of somebody struggling with an eating disorder.
Rather
Um,
than like, oh, I know someone who.
yeah, my friend or my
Yeah.
client or no, yeah, I just
No,
felt like it
like
was,
me.
yeah,
Yeah.
right, exactly. And there is so much stigma around being a therapist and struggling with mental illness. And I don't know, I just wanted to start talking.
Wait, can I just jump in there?
Mhm. Yeah.
Um, okay, here's something I've observed as someone
Hmm.
who rubs shoulders with therapists all the time in my work.
Hmm.
I don't know if I know of any therapist, like what brings a person to that field. You know, who knows? Lots of
Hmm.
different reasons could be there, but I would say it's fairly safe to say what brings people to various fields tends to be kind of what is personally important or interesting. So in my field, a lot of people who are dietitians have struggled with food and became dietitians because they wanted to learn about the science or figure their own stuff out. And I imagine it's very similar in the therapy realm.
Yeah, I think so. But somehow we're supposed to be perfectly healed and perfectly cured,
Self
even though,
actualized.
yeah, no, we're supposed to be, yeah, not human, basically, which doesn't make any sense. And in fact, I think wounded healers often make the best healers.
Yeah, how
But
therapeutic would it
mhm,
be to be in a room with someone who you perceive as being perfect and not human?
right.
I mean, yeah,
Right. I feel like when there's when there's humanists, whatever the word is, in the room, I find that so much more powerful, in
yeah.
terms of my own work with my clients and just in every way. So yeah, somehow we're supposed to be these magical creatures that are perfectly healed and we're going to heal our clients, which by the way is such a diet culture concept. Like nobody, that's not the way life works. We don't fix anybody. There is no magic cure. That's not how things work, you know. It's messy, it's complicated, it's little things over time. There's no fix or cure, but
Amen to
somehow
that.
we're, you know,
Yeah,
yeah.
yeah. Love that. Okay, sorry to interrupt you. I just wanted to kind
Oh no,
of
sorry.
draw that out. No, no, you're
Yeah.
great. So you decided to open up and share about your eating disorder history, and what you were currently going through. Like, talk about what that was like. I mean, I observed it kind of on the outside as someone who knows you and is connected to you, but isn't like, someone who we talk on the phone kind of thing. But
Mhm.
it seemed really, really, really intense. I don't know if that was just me, but I'm interested to hear what that was like for you.
I think when I first shared, I was completely numb. I was actually in partial PHP, partial hospitalization at that point. This is probably like in the middle of the afternoon on a break or something. And I was completely numb. I didn't really feel real. But then as the comments started coming in, I became more and more emotional. And I think what surprised me was that people were a lot more understanding than I anticipated. I thought people would feel betrayed or that I lied to them or that I was a hypocrite, but people really seemed to understand the nuance, which I was really like pleasantly surprised by, and that was really nice. And I think in the beginning, I really didn't get a lot of negativity at all, which was pretty awesome. I think only later on, as other people covered it, and I was on other podcasts, and there was new audiences and people who didn't know me and hadn't been following me from the beginning. Things got a little harder, and I did lose one of my jobs, which was probably the thing I was the most scared of happening. And so there was some loss and some, I don't know, pretty awful moments in terms of like what came out of me sharing. And at the same time, the messages I still get every single day from people struggling, thanking me, and from other clinicians, thanking me, just it means a lot to me. And it keeps me like kind of reminding myself that this is a decision I made and I stand by it. And I think it's an important one.
Yeah. So you were saying earlier that when I asked kind of like what played into how you made this decision and kind of all the thought you put into it ahead of time, you were mentioning like all these myths about like therapists are supposed to be perfect and all this stuff that was probably like swimming in your head as you were trying to decide and what and then you also mentioned that you thought it would be more powerful coming from your own personal lived experience. So is there anything else that kind of like as you're deciding about whether or not to share or how much or in what way, is there anything else that kind of went into that decision for you that you haven't already mentioned?
You just reminded me. Yeah, I think so. At that point, I was struggling with a pretty severe relapse, and my weight did change a lot at that time, and I lost a lot of weight, and that happened publicly. So I had many relapses along the 21 years of my struggle, but this is the first time that it happened essentially in the public eye, visibly in front of thousands and thousands of people. And so people were commenting on my body every single day. And people were assuming things, and people would be like, "Are you dieting?" Or people would be like, "I thought you were health at every size," or the couple of questions of, "Are you okay?" But I just wanted people to know that, like, I this wasn't a diet, and that I wanted people to understand that this was a mental illness. And I think the fact that I lost the weight publicly for the first time was kind of what drove me to share my story publicly.
Kind of because there was no hiding, right? Like
Right.
there was it was either having to yeah, like that must have been such a tough situation to be in. Visually,
Yeah.
people seeing you and asking
Mhm.
questions and commenting, and probably even like, did you get praise? Were people like, "Wow,
Oh, of
awesome"?
course.
Yeah.
Oh my God, tell me your secret. Tell me what you eat.
Mm,
And I'm just like, and at that point, I like, there was a part of me that wished with all my heart that I could be like, anorexia is my secret,
yeah.
Um, but I just kept saying like medical issues, stomach, digestive stuff. Like, I didn't know what to say. So I just kept saying medical stuff. That was kind of my go-to because I wasn't going to say anything, obviously, about dieting or promoting dieting in any way because I don't believe in that. And I also didn't want to share that I had a mental illness. And I don't feel like I mean, if I chose not to, I don't think I don't have an obligation to share with 70 plus thousand people that I have a mental illness. I did choose to, and I stand by it, but it's a decision that I chose to make. You know what I
Yeah.
mean?
Yeah.
So,
Yeah, that must have been really tough to navigate. Okay, so let's highlight that really quick here.
mhm.
Um, you were suffering from an anorexia relapse and you were not in a good place mentally,
Right.
physically, emotionally. It was really not good. Yet here you have people praising you and complimenting or quote unquote complimenting you. This is why I just want to kind of like draw this out and make this point. Like this is why so many of us in this space, you included, Shira, talk about like just you never know what's going on for a person, and praising or complimenting weight loss is just don't do it. Like just
Don't,
don't
don't,
do
don't,
it.
don't.
What else do
It's
you want to say
so
about that?
dangerous. Oh, I want to scream it from a microphone on top of a building. I don't know. And I think it's so easy for people to say, no, but I know this person. I know they don't have an eating disorder. I guarantee you there are people in my life who thought they knew me and thought they knew everything about me and did not know I had an eating disorder. And I think it's so dangerous because we have this idea or this belief that we would know if somebody has an eating disorder. We don't. Like, and I think it's important to make it clear that people with anorexia can be thin and they can be fat, and people with binge eating disorder can be thin and they can be fat, and there is no look to an eating disorder. So just please shut your mouth when it comes to complimenting or praising somebody's weight. Oh my God, I just don't do it ever. And also because let's not continue to perpetuate the idea that thin is better and morally superior and anything else that comes along with it.
Yeah, great points. And oh, yeah. So that point you made about how we might assume that we can tell like a person's health status by looking at them, like just you highlighting that people who suffer from various eating disorders are the body size of someone who struggles with anorexia could be all across the weight spectrum. Same with any
Exactly.
other
Hmm.
diagnosis. So I know that's kind of hard for people to wrap their head around because I think there's always, more publicity for the very, emaciated, thin white woman kind of thing.
Yep. Hmm.
But do you, like, do you want to speak to that? Just like nobody is immune, and nobody necessarily can tell by looking at a person what's going on for them.
Yeah, and I think unfortunately this is what we still see across the media. Like anytime we talk about somebody with an eating disorder, they're always the thin, emaciated white woman, which is so sad because, I mean, obviously, like people of any genders, of any socioeconomic status, of any size, like nobody is immune to an eating disorder, and it's so dangerous to continue to perpetuate that like idea that they have a certain look.
Absolutely. Yeah, totally agree. I'm so glad that we're pointing that out. Okay, so um, what was next for you? You shared, you opened up, you finally just kind of
And then I
found
saw the light. No, I'm
you.
kidding. Sorry.
Okay, yeah, go
Yeah.
ahead.
No. I said it, I was sorry. I was being very sarcastic. I said I saw the light and I was cured and everything was better now.
Yeah, okay, so
No.
I'll talk to you later. We're done, right? With the
Yeah,
podcast?
totally.
Okay, so what happened next?
I continued to be, well, I was in PHP at that point. And then I came home and thought I was going to a PHP that was going to be a good transition while I adapted back to living back in New York into my life. But it turned out to be the biggest mistake. And once again, I went to a treatment center who further harmed me and then gaslighted me in the process and kind of brought up all of my traumatic life experiences of all of my treatment. And so I continued to struggle, went back to California, stayed there for, I don't know, 5 months, and then came home a couple of months ago. It's kind of been a really messy, hard couple of years. It almost feels like a dream. Like
Yeah, I bet.
somehow 2 years passed by and I spent almost all of it like in and out of treatment. So
Okay,
yeah.
so let's dig in a little bit in your treatment experience, just with the intention of learning and
Hmm.
kind of like spreading, hopefully, awareness and helping people who are listening do better, whether that's someone who works at a treatment center or someone who is going to treatment or someone who loves someone who is going to treatment, or, wherever you might fall as a listener with this conversation. Our intention in talking about your experience, and correct me if I'm wrong, Shira, but
Hmm.
we just want to kind of shine a light on where things can improve. What else would you add?
Yes. Oh, absolutely. I think it's important I think the eating disorder field has so much change that needs to be done, and if we don't talk about it, it won't happen. And I think things will just continue on as they are. And I think it's so important to point out like what's going wrong. And at the same time, I want to be clear that obviously there are amazing treatment centers out there, and there are people that get help. But I don't want people to think, oh, like I'm struggling and I shouldn't go to treatment because it's gonna mess me up. Like
Yeah, great point.
I think it's really important to note that if you're struggling, like you can get good help. You just have to kind of just do a little bit of research to make sure that you're going to a place that's good for you.
Okay, yeah, that's a really good point. Yeah, I didn't even think of that. As a listener, please do not walk away from this conversation thinking, taking away, oh, treatment's a waste of time, or or
Hmm.
yeah, I'm not going to find a good fit, because that might not be true for you. Hopefully that's not true for you.
Right.
Um,
And also at the same time, like treatment doesn't have to be what we think it has to be. It doesn't always have to be, oh, residential, PHP, IOP, all the levels of care. Like sometimes it's being creative and figuring out how to create extra support for you in your life. You know what I mean? So it is also important to note that we can be creative and figure out, maybe better treatment alternatives that are not the traditional treatment approach too.
yeah, okay, that's a great point. Okay, so where should we start as far as your experience? Because I don't know the ins and outs of this, so I'm not even sure what
Hmm.
question to ask. But
Yeah.
what's like just kind of the biggest thing that pops up for you that was just not helpful or harmful, or set you back, or just what do you want to speak to first?
I guess something that like I'm even realizing is that even the past 2 years, a lot of what was happening when it was happening, I didn't even realize what was so problematic about it. I just knew that I was feeling worse and worse and I wasn't getting better. And then I felt so ashamed that I was getting this help but not getting better and what was wrong with me. And obviously I didn't want it enough and I obviously wasn't motivated enough. And then I came home and I kind of thought about it more and more and I started realizing how problematic all of these things were. And I think some of it is because of what I do and the fact that I am a professional in this field, and I could put a client in my place and think, oh my God, I'd be horrified if they were told the things I was told. And I think what makes me sad is knowing that not everybody has that. And so people, I don't want anyone else to feel gaslit or to be, I don't know, traumatized or further harmed in treatment because of their body size or other things. Um, but I guess, I mean, the first time I was in treatment, I was 14, and the doctor told me I went there for bulimia at that point, and the doctor told me the next day, like, look what happens when you don't binge and purge. You lost weight overnight. And that was like the first time I learned, like, okay, like I have bulimia, so I still need to lose weight, and restriction is okay because I don't have a smaller body. And that was told to me in eating disorder treatment of all places, you know. And then from there I went to another program also when I was 14, where I was fed differently than all the other patients. I wasn't given snack. I was given significantly less. And I remember thinking, oh, I'm supposed to be hungry. Like this is how it's supposed to be. And so again, I'm getting the message that my body is different. My body is wrong. I need to be micromanaging it. And that was like the first two treatment experiences at 14. And that, you know, that kind of was the pattern throughout my experience. And then unfortunately, this time when I went back, things were a little different. So I went to treatment, you know, at 30, and um, just the way they do the entire food system, it's based on, they did it with exchanges. So you're given a certain amount of what you're supposed to eat during the day, and you can decide how you want to do it. Um, but I would be sitting there and thinking like, do I want to have a good afternoon snack or do I want to have a good night snack? Because depending on which one, like I chose to have a good one, I would have like nothing left over for the night. And so it was literally like I was on this diet in treatment, and I
Ah,
became more and more and more obsessed, and I'd be like counting and calculating. And now I can look back in hindsight and be like, of course I was obsessed and counting and calculating because I was hungry. Like I don't have obsessive thought, like these kinds of obsessive thoughts about food in the same way when I'm actually like eating what I need to be eating. But I came into this program having lost a significant amount of weight, was malnourished for my body, whether or not they believe I was malnourished because I was in like an average size body, but it was a body I was never meant to be in, and I needed to be fed. But I was starving from morning to night, literally put in this diet, literally weighing and measuring every single food that I ate, counting out french fries, counting out grapes, weighing my chips on a scale, like things that are absurd. Like that's what you do in, I don't know, Weight Watchers or WW or whatever it's called. Like, and this was happening in treatment. And like, no wonder I came out still so obsessed and weighing and measuring my food. And I don't know. I feel like I wasn't even weighing my food before I went to treatment, and I was doing it afterwards. So
well,
it's
and
kind
were
of
all the
frustrating to think
other
about.
people weighing and measuring, or was that you, were you
Oh
singled out?
yeah, no, it's part of the system. I mean, some people got to eat more, depending on their bodies and what the dietitians felt they needed. I just knew that I was hungry, but I wasn't going to tell them I was hungry because I had a restrictive eating disorder, and that felt shameful to me. Obviously, I know that there's nothing shameful about hunger, but when you're in your eating disorder, it feels really scary, and it feels like it's wrong, and it feels like maybe you're wrong. And so I just knew I was hungry from morning to night. And yeah, everybody weighed and measured their food. I remember another client, I think she maybe portioned a little too much, and they said, is this binging behavior? And I was like, oh my God. Like
Wow.
yeah, because she didn't scrape like the measuring cup and like flatten it out perfectly. So
Okay,
it's just so
so
sad.
I'm having a hard time like listening to this and
Mhm.
kind of balancing like validating you, but also like like not being so judgmental that I'm gonna like lose my cool as someone who's like interviewing you. You know what I'm saying? So I'm not even sure what to say about that other than like, wow, like that's I don't I don't know where you'd find evidence for that being an effective approach for feeding people in a treatment center. Like I'm just a little appalled.
I think we could have like all of the good intentions in the world, right? We could have like the intentions of being health at every size and body positive and all of these things, but if we don't think about the impact and what happens to a patient who's given these rules and how that impacts them, like we have a problem.
Yeah. Yeah. I mean, okay, so I don't want to make this about me, but I just want to kind of normalize what you felt when you were there. Um, which I've disclosed before, I don't have an eating disorder history. If I were somehow in a place where I lived there and I was being fed there and I had to weigh and measure all my food and I had a certain amount I could have and it was like a budget and whatever. Like everything you just described, if that were true for me, I could see myself developing some obsessive like thoughts and tendencies and kind of just I could see myself responding very similarly to how you responded. And the only reason I share that is just I think when we have an eating disorder diagnosis, we tend to be like, oh, that's just because of my diagnosis. Whereas I think sometimes it's helpful to even take a step back from there and to be like, well, wait a minute, what about people who might not have that diagnosis? Like, how would they respond to this? You know?
Right. hmm I think the thing that makes me the most sad about like reflecting on this is that in the moment I just felt so much shame because I would pull up my exchange book and just be counting and calculating all day and they'd yell at me and I put it back and then I take it out and I was like the bad patient and I felt so ashamed that I wasn't getting better and that I was still on level 1 or whatever thing I was on and I wasn't making progress, but like in actuality looking back, like how could I make progress in that kind of situation? Also, my brain was starved. Like I needed food and nourishment. Like that's like at the ground level, not to mention all the other stuff that happened, you know?
Yeah. Okay, so what else happened in treatment? Anything else that you want to share that you feel is relevant for us to kind of get the picture of what it was like for you?
I think I can just give you like one other quick example, and then I feel like you have a picture. But when I went to the program in New York, and I feel like I've shared this publicly, but before, but and again, I think it's important to note that even if you have the intention of like, oh, we're just like feeding you according to like what your body needs, and this is not about a diet, we have to think about how these things are going to impact a patient who has faced weight stigma their entire life and who was put on diets their entire life and who was told that eating was bad and food is wrong. You know what I mean? So even if their intentions were good, the impact is what matters here. And so we all went out to ice cream. It was for like a snack challenge or whatever. And we went out, and the dietitian told all the other clients, please go get 2 scoops of ice cream. And then they looked at me and said, and you get a kitty scoop. And again, I don't know if I asked for 2 scoops, I don't know if they would have said no, but I wouldn't have asked again because I have a restrictive eating disorder. And it just was another message that my body was different, my body was wrong. I needed to be micromanaging everything that I consumed, and I felt so much shame. And so I did not eat the ice cream at that point, kind of just shut down. And then, of course, was told, like, again, like, you're like choosing your eating disorder and you're not choosing recovery. But really, I was in this setting and the situation that did not give me the opportunity to succeed. So
Wow. Again, just wow. I can't imagine what that must have felt like.
it's just, I'm just sad that it happens in eating disorder treatment centers of all places. And now I'm hearing from other people who are in larger bodies, since sharing these kinds of stories publicly, that they've had similar things happen to them. And so I just think that we really, really, really need to be talking about this and doing things differently and treating people like individuals and not putting people on diets in treatment and not prescribing a behavior that we would be horrified at in someone in a smaller body.
Absolutely. Okay, so just let's state the obvious, which,
Mm-hmm.
you might be like, duh, but someone listening might kind of need us to connect this for them. So that ice cream example, like what would you hope to see? Like what would be ideal for that story, that anecdote you shared? What would you
Mm-hmm.
hope the dietitian would have done for you?
I think I get that there needs to be a minimum of what you need to be eating in treatment, totally, because most eating disorders, there is restriction in them no matter what they are, and it's important to have a minimum, but I don't think there should ever be a maximum. In this case, I think it should have been everyone have the same amount of ice cream. Like, and if with the understanding that if you wanted more, you could have more, you know.
Right. So in other words, not singling you out and giving you in a different amount because that does send the loud and clear message everything you just said, like your body's wrong, you're whatever, right? Like all the
Yeah.
things that
Hmm.
you concluded from that are reasonable. Like so
And the yeah,
yeah.
and the irony is that I was already so afraid of eating ice cream in the first place. You know what I mean? So this did not help situation. By the way, since then I've had ice cream multiple times. I had it last night, in fact, and it was great.
Yay.
But yes,
Do you guys have Tillamook ice cream out there? I don't know if that's like a West thing.
I don't think so. What is that?
Oh, it's the best ice cream in the world. It's so good. They don't pay me to say this, but
You
so
should get sponsored.
right? I know I'm not that cool, but Tillamook is like a either a city or like a kind of a region in Oregon, and they're famous for their dairy, and they make amazing ice cream, all flavors. Their mint chocolate chip is to die for. Oh,
Okay,
everything is so
mint
good.
chip is basically toothpaste.
Oh, you hate it?
But I will try and I just publicly yucked your yum, but
It's okay.
it's fine.
I'm
I'll
not
try to respect
offended.
your
I
flavor.
recognize we all like different things. Anyway, it's delicious. It's such good ice cream. All the kinds.
Okay, I'll add
Um
it to my bucket list.
okay, good. When you come visit me.
Yes.
Okay, so is it okay if we kind of move to sort of the impact and the after treatment, kind of how you processed your experience and how you kind of went from there? Is there anything else you want to make sure to include in kind of painting the picture of your treatment experience?
No, I think we can move on.
Okay.
Yeah.
So, yeah, so tell us about kind of what it was like as you came home and processed what happened. And if you want to kind of weave in anything about earlier, you said that there's ways to kind of get creative about setting up
Hmm.
support in your world. I'm fairly certain that that's going to come up in you sharing kind of what happened next. But
Yeah.
yeah, go ahead.
Um, so yeah, we definitely did get very creative in terms of what I did next because I was realizing that treatment was just continuing to harm me and it wasn't working. And I had been doing this, I mean, first like a 2 month stint, then a 4 month stint, and I was nowhere closer to being okay. And so trying to figure out what I can do to do things differently. And so I'm also very lucky that I'm in this field. And so I had colleagues that were willing to support me, which I'm so grateful for. And so I kind of built my own family. And FBT is a family-based treatment, which it's normally used for kids and teens, but they're actually seeing that it's helpful for adults as well. And the whole point is it's just about meal support, which is really important in eating disorder recovery. So trying to figure out how to create more of that. So I ended up living with a colleague and a friend for 2 months while I was in PHP in California. And so for the first time, I was with somebody that I felt completely safe with in my body and knew that I had full permission to eat what I needed to eat. And I also had an amazing dietitian who was fully supportive of me and my body. And so I was just creating a bigger community and essentially a family that I felt safe with, which I had never experienced before in my life. And I'm still undoing like all of the messages. Even today, like I was eating lunch with my friend and I was like, wait, I'm not allowed to do this. She's like, we cannot take anything that you learned in treatment as what you can and cannot do, but it's still in my brain and I'm still working really hard to undo it, which frustrates me and disappoints me, but it's just the reality of the situation. Um, and I'm still, and as I came home, I still spend every weekend with a few of my colleagues and a couple of weekdays with a couple of my colleagues, just getting us and doing a lot of virtual FaceTime meal support with different friends. And so, yeah, there's still a lot of support in terms of my eating. And I think sometimes I'm sad about the fact that it's still such a minute to minute struggle. And at the same time, I know that I've had my eating disorder for 21 years. And so I need to just give it time and hope that eventually things will feel a little easier.
Yeah, so very much still in process with all of this, but feeling better than right after treatment. Is that right?
Yeah, I mean, coming home to New York was a very big adjustment and I really struggled. But the last 5 weeks, I've been working so hard to turn things around and do things. I don't know. I want to say better, but just do what I can, do the best that I can. And I've what's different this time is that I'm really leaning on the people that are willing to help me. I'm leaning on them for support, which is really hard to do. I mean,
Really
kind of
hard.
similar,
Yeah.
yeah, like and similar to like an eating disorder where you feel like, I mean, where restriction's a big part. it's not just food that you're restricting support, you're restricting help. And so me allowing people into my life and allowing people to see me, all of me, has been really, really important in my recovery.
Yeah, yeah, I love that point. And I think that regardless of where the listener might be in their relationship with food, I think that's a thing we can all walk away from this conversation with of like, okay, am I allowing people to help me? Am I being seen as really like the real version of me? Or am I kind of trying to put something out there that isn't super authentic? Can I be more aligned with what like connection and the things that I value?
Right, exactly.
I'm really interested to hear kind of sounds like you've spent a lot of time with people who have modeled like healthy relationships with food and people who have modeled
Yes.
the things that you're kind of going for. Do you want to speak to that a little and talk about what that's been like?
No one's ever asked me that before, and it's funny because it's been the nicest experience. Like I grew up in a family where, I mean, dieting has been and disordered eating has been just everywhere I looked. And so to now be around more than one, more than two, more than three, at this point it's like six or seven people who eat just like freely. And I want to use the word normal here because I don't know what else to use, but just like to allow themselves to eat food like a person is just the nicest thing for me because it's not something I've ever experienced. We do things like we go grocery shopping and we get to choose foods that look good and not, what food has this amount of grams or this amount of calories or whatever. And I don't know, all of this has been it's been nice to be around people that really, really, and some of them with disordered eating histories, really be free around food and free in their bodies. And that to me is so, so important, because it also gives me hope sometimes,
Yeah.
glimpses of hope that like maybe I can have this too. So
Yeah,
yeah, it's been so nice.
that was my next question. Like what is so powerful about that? Do you think it's hope or do you think it's just kind of like very practical? Oh, I like just by her eating that food with me without apologizing or without explaining just sends me the message like, oh, I'm capable of that. Like it's possible. Like, do you think there's permission, hope, possibility, kind of all of that coming through?
Maybe all of it. It's kind of hard. I'm not sure if I can articulate this, but kind of like eating at this point, it's still, and it's just like it's a body memory, especially because so much like muscle memory, so much of my eating disorder is based around trauma. And so eating feels unsafe and eating feels so anxiety provoking and eating feels like I'm jumping out of an airplane at every single meal. It's kind of exhausting. So to be around people that I feel safe with, and to not be around diet culture everywhere I look, it's just like, first of all, it's an escape from our world because our world is exhausting when you're trying to recover from an eating disorder and all you hear is keto, paleo, intermittent fasting, noom, blah, 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 blah. And then, oh no, it's a lifestyle change, but everyone's dieting. And then I could be around a few people that it's just different. And so some of it is yes, the permission and the hope and the freedom, but also some of it is just like a relief from the relentless exhaustion of like living in diet culture, if that makes any sense.
Yeah, it makes total sense. And it's such a gift when you can be with someone who lets it just be what it is, like an eating experience where you don't need to explain yourself and where you can really enjoy and you don't need to compare. Like, I mean, yeah, I know it's not perfect, but people who foster or cultivate a food experience like that, I appreciate those people in my life too. It's exhausting to
Yeah.
be around people who are constantly judging and criticizing themselves or other people about food or body. That's just the worst.
Yes.
Yeah. Okay. Gosh, what else do you want to share about kind of any big ideas or big kind of structural or systemic changes you wish you'd see in the eating disorder treatment field?
I mean, we covered a lot of it. I think maybe one small addition is I wish we treated people like individuals. And so, you come to treatment and there are these rules and they're black and white rules and they are what they are. But I just wish that people were heard a little bit more. And I wish we were a little bit more flexible in terms of creating treatment for the individual person, unless this is our evidence-based treatment that we're, I don't know whose evidence and who it's based on and what population it was based on, but how we really actually apply it to each individual is kind of really important to think about.
Yeah, that's a great point. And that made me think of something I often kind of check in with myself about, and I'm interested in your thoughts on this, is um, regardless of the field that you're in, if you're a clinician, but if you are asking your like I'll just speak personally. Okay, so if I'm
Mm-hmm.
asking my clients to practice flexibility with their food and to practice trust and to work on satisfaction or to even like engage in exploring like what do I care about, what is important to me, what do I like, what do I not like if I'm asking people to pause and reflect and connect to what's important to them, I should be doing that too, right?
Right, right. Yeah.
So I kind of pick up on uh and this is I'll just I kind of want to say this before say this next thing. I come from the belief that if you love something, you criticize it. And a lot of people think it's the opposite. Like if you love something, then you don't criticize it.
Mm-hmm.
I believe that, you know, I believe in eating disorder recovery. I really do. And I love being in this field. I love doing the work that I do. And because I love it, I will always criticize from a place of compassion and from a place of let's do better and from a place of we're all learning and we're all imperfect.
Mm-hmm.
But so I want to say, I want to give that little caveat before I kind of say, like, I observe a lot of people, a lot of systems, a lot of institutions in this space kind of being like, it just doesn't feel congruent with, like, okay, wait, you're asking people to do this, but then you're doing this.
Right.
Um, right? So have you picked up on that? What are your thoughts on that?
I mean, yeah, I do all the time. And I think so. I'm thinking of one treatment center in particular where I know that they have a blanket rule across the board that every patient there has to see their weight. And the reasoning why is because we want to, evidence based treatment that we're going to make, I forgot the term because now I'm blinking out, but we're just going to
Normalize
make
it?
it normalize it and just kind of just help them tolerate seeing a number
Habituate?
without
Yeah.
habituate. Yeah, all of that. The thing is that for some people, sure, that's great. And for some people, especially people who've experienced weight stigma, that's just not something that is helpful for them, no matter what somebody's evidence based treatment suggested. And so we're continuing to, again, have a black and white statement across the board at a treatment center with no thought or no conversation around the individual person and how that's going to impact them. And that to me is really unfortunate.
But I
And then we're
mean,
expecting them to like recover and thrive and do all the things. But if they're being actively harmed every single day, we're asking a lot.
yeah. Yeah, and I can imagine, just to play devil's advocate, like if someone's listening from a treatment center, they might be thinking, well, if you start making exceptions to the rules, then everyone will want an exception and then it'll just get too crazy. Like, what would you say to that?
I mean, we're not robots. You can't treat people like robots. We're human beings. And I don't know. I think that if you're harming people, like I don't care about like you figure it out. Figure your treatment center.
Be
You're treating
creative.
individual people. Yeah, get creative and treat people like people. Like if you can't figure that out, then don't be in this business. Things are not black and white. Things are not simple. Eating disorder recovery is not simple. Like let's not treat it like it is.
Yeah, and I wonder if even setting like a culture up at your treatment center that's like, all right, here's our approach, here's our philosophy, here's why we do it this way. We take an individualized approach. Certain things will work for certain people, and it's just normal that different people will be doing different things,
Yeah. Mm-hmm.
right? Instead of the paradigm of, okay, everybody that walks through these doors does these exact things this exact way.
Right. I mean, and everyone struggles with their eating disorders in different ways. So sometimes we need to adapt things depending on the person's struggle for sure, too.
Yeah. Yeah, and I'm someone who likes to kind of boil things down to something simple because life gets
Hmm.
really complicated, and in order for me to grasp it, I sometimes have to try to hold on to something simple.
Hmm.
So I realize I'm maybe oversimplifying here, but to me, the work that I do, at least, I see it as trying to identify where rigidity is getting in the way of someone doing what they want to do and what they like living their life to the fullest, whatever that means for them. And so
Mhm.
part of my job, or a big part of my job, I feel, is introducing flexibility into our approach to food and our bodies and our lives. So I think flexibility is a huge, huge part of recovery. I'm
100%,
okay,
yes,
okay. I'm
absolutely.
like
I mean,
I'm interested in your thoughts
flexibility
on
is
that.
the opposite of what my eating disorder wants.
Right, exactly.
And so, yeah, everything is about trying to be flexible. I mean, when you're rigid, you can't go out with your friends, you can't do social things, you can't go to the grocery store, you can't eat out, you can't do anything. So, yeah, flexibility allows you to live a full life, and I
Yeah.
think it's so important.
Yeah, and our treatment hopefully can kind of model that.
That would be nice. That's the
Right?
hope, yeah.
Yeah, and I think like that's kind of what I'm getting from what you're saying
Mhm.
is like more willingness to be flexible in meeting individuals' various and diverse needs is ideal when treating an eating disorder, which is, typically very rooted in rigidity.
Yeah, and I think actually what the treatment center that I was at, where they did the exchange system, is now working really, really hard to. I think they're actually getting rid of it completely, and again, they're going to have minimums but no maximums. So I think that gives me hope. Like they're realizing that maybe it was problematic, and they're working really hard to do things differently and make it a safe space for people in all bodies. So
That's
that to
amazing.
me is, yeah, it's so cool to hear
And
that.
that's such a testament to like it's so frustrating and awful what you went through, but
Mhm.
also I hope you feel a sense of like, okay, like I'm making a difference by talking about this and by trying to make my story not be in vain, right?
Yeah, it's a good reminder when I feel frustrated and hopeless and like despaired to remember that like I am having impact in these little ways, which are not little to
No.
people who are there and struggling. And so that's a good point. Yeah.
And the people who come after you kind of thing, right?
Yes.
Yeah.
Totally.
That's beautiful. Even though it's really messy and ugly in some ways, it's there's some good we can find, I guess.
Yeah.
Um, okay, is there anything else you'd like to share about your experience? Anything else you'd like treatment centers to know, or how about this? People who maybe are thinking about treatment, what would you advise them to do or look into to find a good program for them?
I mean, I'd want them to definitely find out how they do the food. If there's again, if there's maximums, I want to know how they treat people in larger bodies. Is it different? I think Sam Dylan Finch, he created a blog post for people in larger bodies struggling to access Hayes care, and I can go find that. But he has some really good questions to ask. Yeah, but don't be afraid to do research and get the treatment you need and listen to your instinct. If something feels wrong, like go with your gut. It's important.
Yeah, and in retrospect, I wonder, do you wish you had kind of spoken up about what you were feeling and like how hungry you were? Do you wish?
You know what? The truth is, I was so sick. Like, I don't think I could have spoken up at that
Yeah,
point.
yeah.
I went for help and I was harmed. Like, that's the truth. And I mean, I wish I could have been able to use my voice but I don't think anyone would have listened to that point, like, to be honest.
It might have just made
And I
things
also,
worse.
yeah, I think so because when I did speak up at the treatment center in New York, I was told, "Oh, you're so ill. You're so malnourished. Like you're so sick." And so anytime I would use my voice and say this doesn't feel right, it would completely turn it on me and make it about me being so ill and sick. So my voice didn't matter at that point. So I don't know.
Oh, yeah. It's so easy to talk about like, hey, stand up for yourself, speak your truth, let your voice be heard. But
Hmm.
you're right. The reality is that's not always doable. That's not always safe. That's not always um, going to happen. And the last thing I'd want anyone to feel is a sense of shame if that's not been possible for them in the past. You raised some
Right.
really good points there.
Especially with the power dynamic like going on over there. I think what helped me survive was having a friend on the outside kind of reminding me that reminding me of who I was and helping me use my voice when it wasn't safe and giving me the words when it didn't when I was frozen and traumatized. So just like having community and having support is incredibly, incredibly important. That I feel like I don't know if I would have survived if I didn't have that.
Yeah. Oh, I'm so glad. I'm so glad you do. Well, Shira, how can people follow along with your blog or become a client or whatever you have to offer?
Um, yeah, so on Instagram and my blog, it's just at the Shira Rose or theshirarose.com. And then if you want to schedule an appointment with me as a client, my website is shirarosenbluth.lcsw.com. And I work in Chelsea, Manhattan.
Okay. Well, Shira, thank you so much for joining me and for sharing all of this. I know it's not easy to be vulnerable, but you're practiced at this point, right?
Working on it. Yeah, thank you.